Hello, everyone, and thank you for tuning in to today's Google Hangout. I'm Monique Bowman, the NSCAA's Communications Manager, as well as today's moderator. So back at the end of summer, we partnered with Carondelet Orthopedic Surgeons to help integrate educational content along with medical content kind of together. And so today with us from Carondelet is Dr. Scott Luallin, and he's going to be discussing knee injuries, specifically ACL injuries. So hello, Dr. Luallin, how are you?
I'm doing well, Monique.
Good.
How are you?
I'm good. Thank you. So remember, you can submit your questions. We already have quite a few submitted in, so we'll try to get to as many as we can in the 30 minutes that we have. If you have questions as we are talking today, be sure to tweet them using hashtag NSCAA Live, or you can email them in to marketing@nscaa.com. So let's go ahead and jump right in. So Dr. Luallin, could you give us a little bit of a background of yourself? Sorry about that.
Certainly.
Yeah.
Yes, I'm an orthopedic surgeon. I have a subspecialty interest in sports medicine. So I'm board certified in orthopedic surgery, but have a subspecialty certification in sports medicine. And I did a fellowship in sports medicine after my orthopedic residency at Harvard. And so that's the basics of my practice is I do general orthopedics, but I have a subspecialty interest in sports medicine. And I'm the team medical director for Sporting KC, which is our professional MLS team here in town. And I've been doing that, fortunately, for 20 years. It's been a privilege to be able to do that for the last 20 years. Sporting KC used to be the Wizards, but they've become Sporting KC now. And so that's the majority of what I do.
Perfect. One question I do want to ask, kind of a little off script, is the medical profession, as well as your time with sporting, how have injuries changed over the years, or not changed, or maybe the profession has kind of caught up to where the body is? Could you talk a little bit about that?
Well, I think in medicine, there is always a lot of evolution of how you approach injuries and how you treat injuries. I'll never forget my fellowship director, Dr. Zarins, saying there was maybe 2 operations that he did the same at that time that he did when he finished his residency, because things are constantly evolving and changing. And I think with our approach, prevention has been a big portion of what our emphasis has been over the last several years. And so we're trying to get the numbers of injuries down. And then, of course, the techniques in surgery have become less invasive. Arthroscopy or scoping of joints, which is where you use a camera with a lens attached to it, and you can do it through a very small poke hole incision. A lot of surgeries we can do arthroscopically now that used to require a large incision. And there's some very innovative companies coming up with new ways of treating injuries that has enabled us to get people back more quickly and with less pain.
Great. And that question was more both for the coaches that are watching, as well as parents and athletes who are also watching, who just need to know.
Sure.
So what are the 3 main types of knee injuries that can occur, and how do each occur if they're different from each other?
Well, there's actually a multitude of different types of knee injuries, but I guess the primary injuries that we worry about are ligamentous injuries, which ligaments connect bone to bone. So the intercruciate ligament, for example, is a ligament that stabilizes the joint, and injuries to those structures are very common with soccer. You can also have cartilage injuries, which the cartilage is the smooth white surface of the joint that makes the joint move smoothly. And with an injury, you can damage that cartilage. And then there's also meniscus injuries, which the meniscus is actually another type of cartilage that's a shock absorber cartilage in between the 2 bones of the knee. And so those are probably the 3 most common things that we see in the knee.
Okay. And how common are ACL specific injuries among athletes in general versus soccer players?
Well, worldwide soccer, there are more ACL injuries in soccer than any other sport, but that's a function of the number of people participating in soccer.
Okay.
But contact sports such as football have a high incidence of ACL injuries as well. But ACL injuries are very common in the U.S. That it's estimated that there's maybe between 250 and 300,000 ACL injuries per year, and so it's a fairly significant number of injuries.
Okay. And are all ACL injuries or knee injuries season or career ending for soccer players?
It depends on the length of the season and at what point of the season the injury occurs. The injury typically requires somewhere between 6 and 10 months to recover from, and a lot of that is dependent upon if there's any other additional injuries besides the ACL tear that are being treated. But if, for example, the MLS season has become quite long because there's so many more teams now than there used to be, and so it starts in March and ends in December. So you could see a scenario where if someone was injured in preseason or early in the season, they might have surgery and recover and be ready, by the time the end of the season rolls around or the playoffs.
Perfect.
So it doesn't necessarily mean you lose the entire season, but if it occurs mid-season, it usually is a season-ending injury. As far as career-ending, it's rare for it to be career-ending. Fortunately, with the techniques that we have now, most players do return back to play. There's been some studies that suggest that not everyone gets to the same level they were before, but typically they are able to participate.
And now, does that the career-ending piece? I don't want to be too down about it, but is it more so if it's reoccurs an injury in that same part of the body, or is it just how it happens?
It's usually the reason an ACL injury is career-ending is if there's something else that occurs in association with it.
Okay.
If someone has a serious cartilage problem, but you can have recurrent tears of the ACL. Fortunately, they're not particularly common, but it's actually probably more common to tear the other ACL when you've had an ACL reconstruction, that is to tear the ligament that you've had reconstructed. But you can have a recurrent ACL tear. That can have surgery as well. You can do a revision ACL reconstruction and still get people back to participate oftentimes. But sometimes if someone has a bad injury in association with the ACL tear, a cartilage injury or something like that, that can result in a career-ending injury. Okay.
Now, I want to say it's general knowledge, but maybe it's not. But most people are aware that ACL injuries seem to happen more so with females than males. Can you tell us, kind of allude to maybe why, and what are some of the differences that between the male and female body, or the way they're trained, or however that kind of adds to that, females being injured a little bit more?
Right. There's no question that females have a much higher per capita incidence of ACL tears. It's estimated to be somewhere between 2 and 8 times. Most people believe it's in the neighborhood of 4 times as high. And there's been a lot of speculation and conjecture on why that is the case. There's the hormonal changes have been postulated to have a role, although there's never been a definitive study to show that's the case. Difference in anatomy. Females have a bigger angle at the knee level. They have a wider pelvis. And so that's also been considered as a possibility as a cause. The other consideration is the ACL itself is smaller in females, and so that's another consideration. But one of the most important things that has come to light recently is a difference in strength, quadriceps strength and hamstring strength, which in landing technique, and that's been a big focus on prevention here recently, because there has been a definite link between strength, quadriceps and hamstring strength and landing technique and things like that, as far as the incidence of ACL tears.
Perfect. And since you kind of mentioned it already, we have had a lot of questions that came in beforehand, before we started today, about prevention. Can you kind of touch on that for us?
Certainly. Yeah, there's been, as we talked a little bit before, there's been a lot of investigation into what sort of prevention techniques could be implemented to try to prevent injury. Dr. Bert Mandelbaum, who's one of our league medical directors with the MLS, started looking at this a long time ago in the early 2000s and developed a program for prevention. And he's also been part of the team that came up with it's called the FIFA 11 Plus, which is a series of strengthening exercises and post-exercise stretching to try to minimize injuries. And that has been shown to prevent, or at least improve your chances of not having an injury. In fact, there was a recent study published, I think it was 2 months ago, in the American Journal of Sports Medicine, and Dr. Mandelbaum was one of the co-authors, and they had used the FIFA 11 Plus program on college soccer players in the NCAA, and they had, I believe it was a 46% decrease in incidence of injuries compared to controls. And so, and the FIFA 11 Plus is not a technically difficult or challenging set of exercises. They have them accessible on the website, the FIFA website, and they have videos showing you how to do these exercises, and they take maybe only 20 minutes per session. There's also a warm-up session to do on game days. It's a shorter group of exercises to do on game days, and so that's a readily accessible resource for injury prevention exercises. And my partner, Dr. Mike Kadavi, did a Google chat here maybe a month ago or so, and he did a nice job of outlining injury prevention as well. And I think you have that on your website that they can access if they wanted to look back at that. It's a very good review of injury prevention as well.
Exactly. And if you're watching on nsca.com/live, if you scroll all the way down, there is a embedded player of that chat from a few weeks ago. And then you can also find it on our YouTube channel, youtube.com/NSCAA. And it's within our Google Hangouts playlist. So I'd want to fit in this question from Lionel Barrera. I'm sorry for butchering your Twitter handle. And he asked, can you tell if someone is injury prone before injury, or maybe after the first one?
There are a couple things that you can look at as far as seeing if someone has, for example, for an ACL injury, as we alluded to earlier, strength and landing technique are very important for preventing or decreasing your risk of injury. And one of the things that has been noted when reviewing films of people having injuries to their ACL, and is that oftentimes when players land, their knees will cave in together, so they're kind of knock-kneed as they land instead of landing with the knees pointing straight ahead. And a lot of that is relative to strength and landing technique. And so proper landing is important. So if you just have someone simply jump down from a 2 or 3 foot box, or and watch them land, if their knees tend to come together as they land, that's an at-risk position at landing for an ACL injury, and that person probably could really use some agility training to try to minimize the risk. Perfect.
One question that was tweeted in, and we actually have it on our pre-questions as well, are age groups. So are certain age groups more susceptible to knee injuries or ACL injuries? And again, I guess what to look for, you already kind of mentioned it, but are there different things to look for at each stage when you're
right
looking at it?
Well, the highest incidence of ACL tears occurs in the maybe 15 to 45 year age group. A lot of that's just because those are the people that are more active and participating in sports. We are seeing an increased incidence of ACL tears, however, in the younger population as well, because some attribute that to the fact that we're seeing a lot more single sport athletes and year-round playing of sports and things like that. But so there is an increased incidence in younger athletes as well. The as far as what risk level there is by age, decade-wise, I think in your younger population, they're playing obviously a higher level of sport. Typically, they're in better shape and they're faster and doing higher level things. I think as you get older, a lot of times it's maybe the sort of the weekend warrior phenomenon, where they're not as good a shape and maybe their techniques aren't as good. And so I think we see that a lot as people age.
Okay. Another question that we got quite a few questions on was the difference between artificial grass and real grass. Could you touch on that as far as when it comes to knee injuries?
Sure. Yes, artificial grass, when it was first implemented back in the 70s, turned out to be fairly disastrous, as far as it was just basically a little bit of green carpet on a concrete, and so there was a real uptick in injuries, and so that was kind of moved away from that surface as time went on. However, in recent times, they've developed much higher quality turf that's has more cushion to it. The grass is longer, and so there's no question that it's a vast improvement. And a lot of times in a heavily trafficked field where the weather conditions are poor, that may be a much better option than trying to keep grass alive. So, and as far as the incidence on this, higher quality turf and grass, that's something that's being looked at right now a lot. In the MLS, for example, they are tracking this, and there haven't been any big studies out yet, but they're going to be tracking the differences in injury incidence between the two. And so I don't think it'll be nearly as dire as it was before, but I think there probably will be some increased incidence if you have a high quality grass field compared to a turf field.
Now, for some of the players and maybe even the parents watching at home, is there anything they can do at home, whether it's diet or anything else that could help with prevention at all?
I think that I'll allude back to the FIFA 11 Plus. I think those are actually very, very simple, self-explanatory exercises that you could implement even at home independently. I think they're designed for coaches, but there's no reason why parents couldn't implement that at home as well, to have the players use those techniques.
Okay, perfect. And so, heaven forbid, an ACL injury happens. Could you kind of take us through the treatment process from, essentially down on the field through rehab back to competition?
Certainly. First of all, as far as identifying an ACL tear, the typical circumstance is it's actually more of them are non-contact than they are contact, and a lot of people are familiar with that. But basically, 70% of the ACL injuries are non-contact injuries, where someone simply lands or cuts awkwardly, and the ACL gives and they fall to the ground, and there's maybe no one even around them. And so if you have a player who collapses on the field, and the things that they typically mention are they hear or feel a pop in the knee. They oftentimes have swelling very quickly because the ACL is pretty vascular. It has a good blood supply, and so it bleeds, and so the knee usually swells up within 10 minutes or so. And then they have a sensation of instability when they try to step on the knee. It feels like it's going to give out on them. And so if someone has that constellation of symptoms, it's best for them not to try to go back in and play. I've had patients tell me that they tried to go back, and that's not a good idea, because if you have another giving way episode, you may injure other structures in the knee. So as far as the first line treatment, the key is to keep compression and ice on it to try to minimize the swelling. And usually they can weight bear as comfort allows. They may be sensitive enough to where they have difficulty doing that, but if they are able to walk, it's okay for them to put pressure on it because the ACL is really more important for twisting or pivoting activities. So straight ahead walking, people can usually do even if their ACL is torn.
Oh, okay.
And then, of course, if you suspect that injury, then you'd want to have it assessed. And if you have the luxury of having a medical professional on right there, the best time to examine a knee is in the first 20 minutes before someone has a lot of pain, swelling, and guarding. And so you can oftentimes on exam tell right away if that's what's going on. That's oftentimes not the case. It's not practical to have someone at every event, and a lot of these things occur when there's no one around. But you want to get it assessed as soon as you can because if you do have an ACL tear, you want to go ahead and implement a rehab program to try to get your motion back and get the swelling down in preparation for the definitive treatment, which would be surgery.
Okay.
And so, go ahead.
No, you can finish.
Okay.
Sorry.
That's okay. Then as far as, when someone does have the definitive diagnosis of an ACL tear, which is usually confirmed on an MRI scan, you will start a prehab program. We call it, it's basically rehab before surgery or prehab, where they work on getting their motion back. And so oftentimes surgery is delayed for maybe, a week or 1 to 3 weeks to try to get their motion back before surgery. Because that helps their rehab after surgery. It helps them do much better, right after surgery. And the surgery itself is the ACL does not repair itself, and you can't sew it together. It has to be reconstructed, which means that you take a graft from somewhere else and put that where the ACL used to be. And so there's a number of choices on graft, and I don't know, that may be beyond the scope of this Google chat, but there's a couple of different choices on graft and techniques. But once the surgery's done, you start rehab right away once again to get them moving, and after surgery, the recovery time is usually in the 6 to 10 month range. Again, it's all dependent on whether someone has any injuries associated with the ACL tear that may sometimes slow things down. And also it's individualized because the return to play is a functional return to play. So they have to pass a battery of functional tests before they're ready to come back and play.
Perfect. Is there a period of time? I know you said 6 to 10 after, 6 to 10 after surgery. Do you find that there's a certain amount of time that's best, or like you said, is it just per person?
It's individualized based on, part of it is graft choice. We talked about grafts a little bit. You can use the patient's own tissue, which is usually better to harvest a portion of their own tissue and use that for the graft, or you can use a donor tissue, which we'll usually reserve that for redo ACLs, or if someone has multiple ligament injuries, we'll use it for that. But if you're using their own